Hi, my name is Deborah Gartenberg. I'm a psychologist at the Emotional Health CBT Clinic, and I'm here today to talk about eating your emotions, CBT for weight management and body positivity. So for beginning, we're going to start with talking about what are some standards of health and statistics in Canada, some reasons to address weight, as well as what is normal healthy eating and how can we encourage healthy body image. We also are going to talk about how eating and body image can lead to disordered behaviors and thinking. And overall, our goal is to talk about making changes for people who are interested, as well as turning those changes into goals and practical tools for goal setting and weight loss strategies. Overall, our goal here is to talk about how cognitive behavior therapy can work for individuals who want weight management techniques, as well as for individuals who may have disordered thinking or disordered behaviors. The biggest part of our summary is going to be culminated into 10 tips for psychological flexibility and body positivity. And we're here to help you with what you'd like to achieve and what your goals are going to be. So to start, about some statistics on Canadians and weight. So in the 2015 Canadian Community Health Survey, 36% of Canadian adults recorded a normal weight. And the updated statistics, even in 2018, reported that meant there was a stable adult obesity rate, which had been on the rise since 2009. So while that rate has stabilized, it was still quite high. 61.8% of Canadians reported a weight which ranged from overweight, which is a body mass index of 25 to 30, or even obese, a body mass index of above 30. 35% of Canadians reported weight in a category that was overweight, and 26.7% of Canadians recorded weight in a category that was considered obese. While there were more men than women, ultimately it was relatively balanced in that most health risks that were associated with weight came out of people in the category of overweight and obesity. So of these categories, these increased health risks culminated into different areas of health, including type 2 diabetes, high blood pressure, and heart disease when compared with adults of normal weight. The other pieces that we want to discuss are the fact that eating habits have an effect on your emotional health. The foods you eat affect how you feel, and there's consistent research impacting our mood when it comes to our nutrition. Also, there are studies that show a disproportionate number of patients with mental health problems are obese compared with the general population. There wasn't specific links to causality, but this link does exist between overweight, obese, and mental health challenges and mental health issues. Obesity, as it's defined, is a complex issue. It comes from multiple factors, some of which are biological, including genetic factors, which have been shown in research. When you do studies on identical twins with the same genes, they're likely to be of same weight twice as many times as fraternal twins who don't have the same genetics. Mice, when they do genetic studies, have genetic links or hereditary links to being overweight. There are gland issues in terms of the biological factors, in terms of underactive thyroid, although less than 5% of people with weight issues are due to thyroid. Thyroid can impact weight very significantly. There's also other hormones that influence appetite, metabolism, and body fat distribution. There's other factors that have been researched in different areas. There's something called the fat cell hypothesis, where size and quantity of fat cells in an individual are linked to obesity since childhood. For example, 80% of overweight children tend to remain overweight into adulthood, theoretically due to their fat storage. And then there are older studies showing that obese children and consequentially obese adults might have more of these fat or adipose cells. There's also metabolism, and that genetics, hormones, and other aspects of health influence our metabolism. We can see in research that exercise does have an impact in boosting metabolism. However, erratic dieting and starvation, when we restrict excessively, can slow metabolism. There's also the nature-nurture debate. You know, how much is it environment? How much is it genetics? Some studies showed that in terms of obesity, if it's one parent who's obese, then there's a 40% chance that the child will be obese, so it's not directly linked to heredity. But in two parents being obese, then there's an 80% chance. So it's, again, is it the genetics? Is it the environment? There's also studies that show that mother's measurements correlate most with the child's. So is that more of a genetic issue? Possible psychological factors are what we can most focus on in therapy. Things like how people cope with stress and emotions, whether they eat as a way to soothe, whether eating has learned to become a place of reward. Also foods and eating being associated with positive memories. Those are things that lead to coping strategies related to eating. The other pieces are responses to external stimuli. Being in the kitchen, for example, when you're spending a lot of time there and having access to food, or when we're looking at advertisements, or when we're looking at anything that becomes a learned trigger for behavior. Then there are deeper issues such as our emotional health and self-esteem, past abuse issues, things that may have triggered coping mechanisms related to food. We're also interested very much in talking not just about problematic issues, but what is normal and healthy, and how can we reinforce that? So in terms of Canada's food guide, there was a change in Canada's food guide since January 2019. And the visual is very clear, having plenty of fruits and vegetables, eating quarter protein foods, a quarter whole grain foods as what they would like to promote, and making water your drink of choice. Overall, increasing your intake of fruits and vegetables to up to 50% of your eating habits, if not more, and balancing the rest of your food intake with higher protein and whole grain carbohydrates are based more on research and can show more healthful results. Choosing water over drinks that contain calories, and eating more plant-based foods over meat and dairy. Previous Canada's food guide recommendations had focused more on food groupings and specific serving sizes and daily requirements. So this modifications are a real change to the way Canada is promoting healthy nutrition. The other pieces that you can find on the Canada's Food Guide website are that they don't even just talk about what you should eat, but how to eat. Being mindful of eating habits, being present when you're eating, focusing on what food and eating is like, cooking more often instead of ordering in, enjoying food, having a healthy relationship with food, eating meals with others instead of eating in isolation, using food labels, using information to access food decisions, being aware of food marketing and how those influence decisions, limiting foods high in sodium, sugars, or saturated fat, and involving others in planning and preparing meals. Finally, noticing when you're hungry and when you're full instead of eating reactively. So normal healthy eating is also a concept that we want to promote, which includes a balance, this balance of types of food like protein, carbohydrates, and fats. No extremes of consumption or restriction, no extremes of elimination. no extremes of trying to get rid of the calories we consume. Normal healthy eating is also non-judgmental. So considering energy-dense foods as occasional instead of bad, even relabeling foods from good or bad to energy-dense versus less energy-dense. Normal healthy eating is also psychologically flexible, which is a term we're going to get into later in the discussion. That means eating occurs in different ranges. Sometimes overeating happens, sometimes undereating happens, and it's not an all or nothing kind of approach. Emotions and circumstances can influence eating at times, and overall eating, if it's normal and healthy, is regular, it's predictable, and it balances knowledge and intuition. The other piece, which is a normal and healthy body image. Body image, which is an inner view of your outer physical body, is where we want to address concerns. Normal concerns are mild to moderate. Most people will say they have some type of body image concerns. However, preoccupation and discontent about your appearance is not something that impacts your life if you have a healthy body image. Behaviors about body image don't cause distress, they don't cause impairment, they don't interfere in your functioning, and one perceives both flaws and beauty, and that's what leads to a normal and healthy balanced body image. So we just put in this term of looking in the mirror with kindness. Moving on, we're going to talk about when eating habits become disordered or when body image becomes disordered. And those are unique situations where you have disturbed eating habits, which are about either restricting food intake, having very strict dietary rules, having a preoccupation with food, and perhaps even up to the point of binge eating. And also controlled behaviors in order to prevent feared consequences like weight gain lead to things like compensatory behaviors, compensating for calories consumed, excessive exercise, and excessive meaning not within a reasonable focus or to the point of intentionally overreacting and over-responding to calories consumed. Also vomiting, laxatives, diuretics, and other medications specifically to control weight. These eating habits and behaviors are termed disturbed when they become harmful through extreme use. So the types of eating disorders, according to the Diagnostic and Statistical Manual of Mental Health Disorders, is anorexia nervosa, bulimia nervosa, and binge eating disorder, as well as other less common types of disorders, such as avoidant and restricted food intake disorder without body image preoccupation, and other specified feeding or eating disorders or other unspecified eating disorders. Just to describe the general criteria that the DSM-V endorses, it would include for anorexia nervosa, restriction of food intake leading to weight loss or failure to gain weight resulting in significantly low body weight. And we'll talk about what body mass index is coming up, or what would be expected for someone's age, sex, and height. Also a fear, not just a discomfort with, but a fear of becoming fat and gaining weight. As in addition, a distorted view of themselves and their condition. There's two subtypes: restricting, where the person doesn't engage in binge eating or purging, and they usually are prone to starvation, and binge eating purging subtype, where they have excessive food restriction and fear of gaining weight, in addition to unsuccessful binge and purges in terms of their behaviors. With bulimia nervosa, the binge eating episodes are recurrent and include, and just to define what is a binge, it includes eating in a short, discrete amount of time, an amount of food that is definitely larger than what most individuals would eat. While that seems subjective, there are measurable aspects to it. And there's also this sense of loss of control and extreme sense of guilt or shame following the eating episode. So the recurrent and inappropriate compensatory behavior that follows is part of the bulimia categorization, and it includes vomiting, fasting, laxatives or diuretics or other medications to eliminate weight, and excessive exercise, not reasonable, but excessive exercise. So binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months, and one evaluates oneself excessively due to shape and weight. And it does not incur in episodes during anorexia nervosa. So it's usually categorized in people who are not in a high danger, low weight. There is also binge eating disorder, which, as we defined, binge episodes are recurrent and they're associated with either eating more rapidly or to excessive uncomfortable fullness, or larger amounts without feeling physically hungry, or eating alone because of embarrassment, or feeling disgusted with oneself, depressed, or very guilty afterwards. And there's marked distress when eating in binge quantities is present, and it happens at least once a week for 3 months. Again, these are not episodes of overeating, which is in the normal category. This is discrete binge episodes that are beyond the normal amounts and lead to a sense of severe loss of control. There's also in binge eating disorder, there's no inappropriate compensatory behavior such as the ones described in bulimia nervosa or the binge purge subtype of anorexia. Body dysmorphic disorder is specifically about body image and appearance preoccupations. So one can be preoccupied with an aspect of their body image, like their arms being too fat, or an aspect of their facial or physical appearance, which they become preoccupied with. It includes repetitive behaviors performed in response to the appearance concerns. And it's significant in that it causes distress and impairment. So it could be, needing to look in the mirror so much that one becomes late for work, or social impairments like difficulty being around people because of the dysmorphia. It's different from an eating disorder because it's not specifically about weighing too much. It's not specifically about shape. It's specifically about an aspect of the body image that one becomes preoccupied with. So specifically muscle dysmorphia, some people are preoccupied with their body build being too small or insufficiently muscular. Or the level of insight can also be a specifier, how much they realize that their belief is not based on evidence, but based on a belief that they have that's very fixed. So moving past disordered eating, we're going to talk about what most people must be here for, which is making changes. Regardless of whether there's a clinical issue, understanding how we change and setting effective goals is an important piece in order to manage our weight and in order to have healthy eating habits. So just talking about change in general, a lot of people get fixed on the idea of being motivated or unmotivated. And what we'd like to challenge is that there are no unmotivated people per se. All people may be unmotivated about one thing and motivated about another. Everyone at some point in their life is ambivalent about something, and everyone at every point in their life is a bit ambivalent about something else, meaning they're on the fence about something they could change. So if you look inside yourself, you probably see, yeah, there's something in my life I could probably be changing, and that's a normal human condition. The other piece is people can and do change for good, regardless of challenges, regardless of level of functioning. Human beings are capable of change. And motivation is not stable. So you can be motivated 1 minute and motivated more or less the next. And that is a normal state. Ambivalence is normal. Being on the fence, having two different urges at the same time, that's normal. And the reason we promote that is that in order to be willing to make changes, we have to be okay with uncomfortable feelings that come from ambivalence. uncomfortable feelings that come from being on the fence and not being ready or willing or able to make a change. So moving from thinking about making a change to planning to actually being in action for making a change, we have to address our commitment to change. So that requires, first of all, facing that ambivalence. How can I look at what I'm uncomfortable with and really face the decisions I have to make? Well, one is to make a decisional balance, which is highlighted here of, looking at the pros and cons of the change itself, as well as looking at the pros and cons of the status quo. And also measuring how important the change is to me in my life right now. How confident am I that I can change, and how well my life is set up for being ready for change. There are different areas of our life, different times in our life where it may be more or less important. We may feel more or less confident, and our life is more or less set up for change to be easy or possible. Talking about change leads to goal setting. So when it comes to making a commitment and then finally declaring readiness for that commitment, then comes the planning. And planning is more effective when we follow what we in the business call SMART goals. SMART goals are plans that have a structure. But without SMART goals, we have ideas of something we want to do. We have dreams of things we'd like to do, and we have wishes of things we'd like to do. When we shift those into a SMART goal structure, we make goal setting practical, achievable, and sustainable. And what does that look like? Well, it looks like breaking down the word SMART into goals that are specific, meaning I know exactly what I am concretely looking to achieve. Goals that are measurable. This is what it would look like when I have a result. Goals that are attainable. There are steps I can take along the way to achieve this goal. And goals that are realistic, that it fits in with my lifestyle. I can do this. Finally, when we have goals that are timely. When it comes to creating specific goals, a specific goal has a much greater chance of being accomplished than a general goal. So for example, a general goal would be, I want to stop overeating. You know what? That is a really valid goal, but it's not specific enough to say, what would I like to do? How would I like to get there? So a specific goal could be, I want to start daily meal planning. In terms of measurable and attainable, a SMART goal that is measurable establishes a concrete criteria for measuring progress towards attaining this goal. So I know what it's going to look like when I've reached this goal. And attainable is figuring out the steps necessary for reaching these goals, breaking down those steps into manageable and reasonable tasks. If a goal is realistic, it includes elements that you can adapt to your life to attain. It includes what we call raw, which is that you are ready, able, and willing in your life experience to approach this goal. Also, a goal being timely means it should be grounded within a time frame. I know when I'm going to check in on this goal. I know when I'm going to have steps along the way that are going to happen in certain time frames. It enhances our effectiveness by using reinforcements for achieving goals within the time frame. So if I say I'm going to have a meal planning structure set up by the end of this week, then I can also reward myself in a way for having met that goal. Incremental goal setting is a way to approach goal setting that is also more realistic and effective. So we can look at our goals with different components of increments, things like, what am I going to do in the next 24 to 48 hours? How am I going to approach this goal in the next few days or few weeks? How am I going to respond to this goal within a few months, maybe up to a year? And then within a year or more, what goal is going to be there for me? And perhaps there's no long-term goal, and that's possible too. Or perhaps we're using this long-term goal and then working backwards with immediate short and medium-term plans. Overall, when we finally break down our goal setting into action plans, that's when we're getting pretty concrete about it. And when we start to say, this is my goal, these are the steps I plan to take, I'm going to now plan a time to begin, not just a time to check in, but a time to begin, I'm going to identify what could be the obstacles to achieving this goal, and I'm going to create strategies to overcome these problems, as well as measures to follow up on progress. I also have a preference for acceptance and commitment therapy, which is a type of therapy in CBT of the third wave variety. What that means is it has a different take on cognitive behavior approaches, including connecting the approach to meaning and purpose and our values. So in acceptance and commitment therapy, we set goals that are not just specific and measurable and attainable. We also make sure they are meaningful, that they have some kind of connection to our values and what matters to us in this life, that they are adaptive, that our life fits into it as much as we fit into this plan in our life, as well as being realistic and time-bound. And so in addition to creating an action plan, we create a willingness and action plan. So beginning with, where does this goal fit in with my values? If I want to address weight management, am I doing it because I think it's a good idea and I think it'll make me happier? Or am I doing it because health and nutrition matter to me? Am I doing it because it's something that's good for my mental health? Am I doing it because it's something that is connected to who I want to be as a person? Also establishing the steps to be taken and preparing for what is uncomfortable. Like, you know what, I'm going to set up this goal and I'm going to have difficult thoughts and feelings along the way. I might have difficult sensations. Sometimes I'm going to feel cravings and those are going to be uncomfortable. Sometimes I'm going to have urges, maybe urges to just give up on the goal, maybe urges to just give in to cravings. And I'm going to challenge those with reminding myself why the goal was important to me in the first place, what mattered to me about this goal, and taking the basic steps. So now we're going to talk about weight loss strategies, beyond diets, beyond specific tools and techniques of weight loss itself. We're going to include those in addressing beliefs and behaviors. So there are certain books that we tend to use in our clinic. One is the Beck Diet Solution. There's also the Weight Loss Workbook by Judith Beck. And she uses cognitive therapy approaches to help restructure our thoughts about weight loss. So cognitive behavior therapy for weight loss in this approach includes a 6-week structured plan for making changes to our thoughts and changes to our behaviors that are reasonable as well as sustainable. It addresses both internal triggers, so the things that get us to overeat, as well as external triggers like other people, settings, and environments that promote overeating. And it helps us manage challenges and negative thoughts on our weight loss journey. So looking at week by week, what is proposed, the cognitive. So first of all, what's going on in the thought process? Well, we want to look at what are the benefits that we would like to see with weight loss or weight management. When we talk about cognitive behavior therapy, recording things, writing things down has been shown to be very effective. So writing down, what are the advantages to me of weight loss? Also validating and giving myself credit when I do weight loss strategy. Becoming more aware of my triggers and just being very conscious of all of that. From the behavioral side, it's really checking out what are some weight loss plans that would work for me. So it doesn't tell you, choose this plan, this is the approach, go Weight Watchers, go Jenny Craig. No, it says you can find a plan. Just choose a plan, narrow it down to a couple of options, and then finally choose. Once you make a decision, then we're going to help promote how that decision can work for you. The other point is sitting down and eating mindfully. When we eat mindlessly, which is what most people do, we're not attending to the experience of eating and we tend to overeat. Reinforcement is a huge behavioral part of making changes. So engaging a coach when it comes to making changes, whether it's a formal coach, someone that you've decided, like a nutritionist or someone that you're going to engage professionally, or whether it's a friend, a buddy, somebody in your life who can be supportive and help you through that. arranging your environment, arranging your life in such a way that it's easier and more possible to make changes. And that's just week 1. Week 2 addresses the cognitive by helping create concrete plans. Things like, well, when am I going to exercise? What are going to be my goals and how are they realistic? Then we can talk about differentiation of the things I interpret. How do I differentiate between hunger and actual cravings? And so there's ways that we can help you measure, well, this is hunger, and it makes sense that this is hunger, and this is actually a response to an emotional thing like a craving. And being able to challenge thoughts about cravings and recognize when something isn't actual hunger. From the behavioral aspect, it's scheduling, it's writing down concrete plans, it's practicing hunger tolerance when I'm not actually empirically hungry, or when I'm trying to be able to balance when I do eat and structure it. And it also helps with the planning aspect. If you've ever heard the statement, failure to plan is planning to fail. And the more we do plan, the more we start to see results. In week 3, the cognitive aspect is about noticing your thoughts while you're monitoring your behaviors, while you're monitoring what you're eating, your eating habits, changing your definition of full, knowing what has become full for you in the past and what you would reasonably expect full to be based on a healthful approach. Challenging sabotaging thoughts. What are some things you tell yourself that lead you to give up? What are some things that tell yourself that interfere with your goals? And connecting your thoughts with your emotions. When you have thoughts about your shape or weight, when you have thoughts about your food intake, when you have thoughts about any aspect of eating in general, what feelings come up and how do they impact your eating? The behavioral approach, again, continues with monitoring and recording. Writing things down really helps concrete and solidify your approach. Preventing unplanned eating. Doesn't mean you're not going to have snacks, but if you plan your snacks and not, again, rigidly, but having as little unplanned eating as possible in your routine. And practicing recommitment in the face of setbacks. It's normalizing setbacks. It's saying, hey, you're going to take a few steps forward and maybe a step back, and that is normal and natural. So how can we recommit when that happens? And finally, when it comes to weighing, neither too much or too little. Basically, weekly weighing instead of daily or multiple times daily, or avoidance of weighing, which can happen as well. Avoidance because of the discomfort of the number on the scale. When it comes to week 4, they talk about dealing with disappointment, that we kind of hit a plateau after a certain point. We need to be able to talk to ourselves differently about our expectations, or making space for what we would call acceptance and diffusion, making space for difficult thoughts about what we would have normally expected. Also addressing what we would say is distorted thinking. Distorted thinking comes in the form perhaps of unfairness syndrome. This person can eat this way and they don't gain a pound, or I should be able to eat what I want. It's not fair. Why do I have to deal with this? We all have thoughts like that, and normalizing it and then addressing it as, well, maybe it's not 100% true. Or maybe it's just not very useful for me, and having that thought and a preoccupation isn't helping me towards my goal. Identifying sabotaging thought by asking ourselves certain types of questions. Well, is this always true? Is it true in every time? What would I tell a friend if they were in the same position? These are what we mean by Socratic questions. We ask ourselves questions to lead to the conclusion that would be more useful for us. Finally, recognizing thinking errors. Are there some all or nothing thoughts in there? Is there disqualifying of the positive? I did so well for 5 days and I maybe had a difficult 6th day. Am I forgetting that 5 days went by and I was really on task? Behaviorally speaking, it's about committing and recommitting to change in writing, whether it's revisiting that advantages card that you made at the beginning, whether it's recording your food intake and the thoughts and feelings that come along with it. And are you still weekly graphing your weight? Finally, when it comes to week 5, challenging food pushers. Are there people in our life that encourage us to go off track with our goals? Are there situations in our life that promote going off track with our goals? Addressing choices when it comes to ordering in what used to be dining out, drinking and how drinking impacts our eating habits, and challenging distortions about exceptions. For example, well, it's the holidays, and then what we tend to realize, well, then there's event after event after event, and they are no longer exceptions at a certain point. Recognizing emotional eating as well. When am I eating to cope with emotions instead of eating and having coping mechanisms that are more effective for my emotions? When it comes to the behavioral approach at this point, it's planning strategies for external pressures and knowing when I'm going to be around other people who promote eating, what am I going to do? When I maybe see certain advertisements that get me to eat, or when I'm specifically in a space where I'm normally likely to eat. For me, it's the kitchen. What am I going to do in those situations? How can I have a strategy to deal with that? Writing concrete plans for predictable sabotages. Well, if I know that if I'm on a day off and I'm going to be just kind of hanging out and relaxing, and that's going to lead me to graze and go more and more and more into my kitchen to get something. Well, what can I do to plan around that? Having practice solving problems as they come up instead of just saying, oh, well, here's a problem and I have to give up now. And again, continuing with weekly weighing. Then we have the week 6, which is addressing all the beliefs that you start to learn about yourself over the 6 weeks. Addressing predictable thoughts and addressing feelings about when plateau happens, because that's normal and natural. You might have a series of loss of, let's say, a pound or a few pounds per week for several weeks, and then your weight stabilizes, and what happens? And how do you deal with those thoughts and feelings? And then practicing ongoing cognitive restructuring, practicing challenging difficult thought patterns, challenging unhelpful thinking styles. Finally, in terms of the behavioral, the techniques of reducing stress. What am I going to do to deal with my body and my emotions that does not include eating? Exercise for both stress management and for weight loss. Keep it up. Start, continue, and reinforce. Reinforce meaningful and masterful goal setting. Masterful, that I know I can accomplish it. It makes me feel good that I can do this. And of course, practice, practice, practice. Now, when it comes to body image and disordered behaviors, we're not going to spend too much time on it, just to recognize that there are concrete strategies and concrete tools out there when body positivity is seriously impacted by preoccupation and behavior change. So there's a book called Feeling Good About the Way You Look for dealing with various levels of distortions about body image, from mild to body dysmorphic disorder, which I mentioned earlier. And also addressing commitment to change and goal setting. It introduces cognitive techniques to manage serious thinking errors about your appearance. It introduces what we would call exposure therapy, facing your fears. So whether it's a fear of weight gain, whether it's a fear of a number on a scale, any type of fears created in our minds and then reinforced by avoidance, exposure therapy is a specific approach to help slowly but surely face those fears. And finally, reflections on core beliefs about appearance. Where did my beliefs come from? What are some really deep, down in my heart beliefs about what these mean for me? There is a type of cognitive behavior therapy for eating disorders labeled CBT, which was created by Christopher Fairbairn. And when they call it a transdiagnostic view of eating disorders, it means it would be an approach for anorexia, bulimia, binge eating disorder, and all the complementary disorders. So eating disorder cases often have overlapping histories and presentations. Someone might have a period of anorexic behaviors, then a period of bulimic behaviors, and a mix of different disordered behaviors and thinking patterns. And therefore, the approach is to help someone with a complex history as well as what they're dealing with now. It also addresses these core beliefs that are common to all eating disorders, which is the overevaluation of shape and weight and the overestimation of the need to control them. That my shape and weight is so much more important than everything else in my life. And if I don't control them, I am judging myself so much more harshly than most other people would. It also is about dealing with excessive preoccupation, and that these efforts to control shape and weight lead to excessive and increased efforts to control. And that just becomes this vicious cycle. So part of it is about education about the development of eating disorders, things like how self-judgment and the link between how we think about ourselves and our shape and weight, and then the strategies that lead to weight control creates this vicious cycle of negative self-image. That mood changes with all these behaviors can become erratic and increase efforts to feel in control, and that the only place we feel control is with our food. So that can be this vicious cycle that perpetuates from erratic moods to poor self-image to maladaptive weight strategies, and they just all keep going back and forth. The step that starts, which is similar to what we would do with weight management, is called self-monitoring. So things like food diary, but the additional piece is recording our thoughts and really becoming aware of thinking errors and how we become preoccupied with something that may not be 100% true. It also addresses increasing regular eating, how it's been far more effective preventing excessive overeating and binge episodes if you eat every 2 to 3 hours than if you have evidence of starvation moments, because starvation can induce binge eating. Also, regular eating, not more or less frequent than once a week, which is also promoted in healthy eating. People who are preoccupied might excessively weigh themselves, or people who are fearful of weight gain might excessively avoid weighing. And that would be an exposure to the normal fluctuations, that it is normal for a weight to cycle and not be exactly as we want it and not need excessive control for a specific stable number. So this data collection leads to creating links between our moods and our behaviors, and how strict dietary rules and thinking errors lead to maladaptive behaviors. Overall, what we're talking about is cognitive restructuring, recognizing that over-evaluating our shape and weight is unhelpful for us, and we want to challenge harmful thoughts, and we want to challenge dietary rules. We can have guidelines, but rules that if I don't do this, I'm bad or wrong, or I need to feel guilty, or it's a horrible, catastrophic thing. We want to reduce overchecking. We want to reduce avoidance, and really what we would call walking that middle line. I can be aware without being excessively preoccupied. Working on improving self-esteem and changing unhelpful mindsets. So what we're going to summarize with now is 10 tips for psychologically flexible body positivity. What does that mean? Well, tips that are psychologically flexible mean that you can make space, metaphorically speaking, for difficult thoughts, difficult sensations, and difficult feelings when you're acting on something that matters to you with your values and your goals. So psychologically flexible strategies include you adapt to fluctuating demands of the situation. For example, if there's an event, you might have difficult thoughts and feelings at those events about whether you're going to eat or not eat according to your guidelines. You might have situations that trigger uncomfortable emotions, and you reconfigure your mental resources to be able to have uncomfortable feelings and still be okay. You shift your perspective and you balance competing desires, needs, and life domains. Your life demands of you, and being able to set a goal and be able to stick to that goal because it matters to you also requires a balance of how it fits into your life. There's also the concept of dialectical thinking, which is the ability to see issues from multiple perspectives and to arrive at the most both economical and reasonable reconciliation of contradictory information. What that really means is two truths are possible at the same time. I can accept myself as I am, and I can want to change at the same time. So being psychologically flexible and dialectical is about promoting healthy eating and body positivity while still wanting to make any changes that you can make. This all or nothing thinking is reduced when you can think dialectically and flexibly. So tip number 1, give up diets. Any approach with a rigid rule will fail. Anything that gets you a rigid, very strict approach is going to risk a rebound effect. Oh, I've had one chip. Well, I might as well eat the whole bag. Or if I have signals of starvation, I feel very, very hungry right now, I need to eat and eat and eat and eat until I'm excessively full. So these all or nothing experiences that come with rigid rules are really set up to fail. And then, of course, failing leads to giving up on efforts or postponing. And it can result in this vicious cycle of diet failure, diet failure. And, you know, you have had people say, I've lost over 200 pounds in my life, but I was never more than 20 pounds overweight. Psychologically flexible approaches include, I try hard to eat well, I exercise generally, and once in a while, I'll give in to temptation. The real issue is not the once in a while. It's the when once in a while becomes regular. Everyone, as we talked about with normal eating, overeats sometimes, undereats sometimes. It's the repetition where it's not actually sometimes because we haven't even tracked it. That's where it becomes a problem. Plan for specific situations. Get to know when do you overeat or eat mindlessly. What are some goals that you can create around that? Can you make more plans of replacing what we would call calorie-dense foods with nutrient-rich, lower calorie density foods? Replacing urges with other activities. Choose behaviors differently and choose them in advance. Try not to be blindsided. Try to predict and plan. For example, if you usually get cravings at 3 o'clock in the afternoon for chocolate, have a more nutritious replacement on hand and available. If you're snacking in front of the TV, can you replace that with another activity? Can you knit in front of the TV? Can you do something else with your hands in front of the TV that would be useful for you? Or can you do something besides sitting in front of the TV? If you have a dinner with other people, which probably right now is not very promoted, but how can you behave differently if you have what we would call food pushers in your life? If people make you feel guilty for not overeating or not eating outside of the guidelines you've set for yourself, there's always a polite way to decline and be consistent. And finally, if you're at a restaurant or if you order takeout, set aside the portion that you're going to have instead of feeling obliged to eat everything that's in front of you. Pack away the leftovers right away. Get ready for it. Plan for it. Managing thoughts and emotions. Cognitive behavior therapy in general is about managing thoughts and feelings. And so we want to help you with cognitive restructuring by identifying what thoughts bring up really intense emotions. And then we can use different questions like, well, where's the evidence this thought is true? And now I can replace that with a more realistic or useful thought for myself. For example, not related to food, but if I think my daughter hates me and I change that, well, my daughter becomes upset when I say no, then can I change my emotions as well when I reframe and think about it differently? Relaxation techniques and mindfulness techniques like deep breathing, muscle relaxation, visualization, ways of letting emotions pass, these are more effective ways than using food as a coping strategy. Distractions, going for a walk, calling a friend, these are things you can do if you have an urge to eat when it's not the appropriate time, it's not planned for. Problem solving, defining the problem, brainstorming solutions, pros and cons of different problems in your life that might trigger eating. Deciding and implementing, and whenever possible, take action as a great way to manage emotions. And exercise. Exercise is super both for weight management and for emotional and thought management. When it's specific to your thoughts about your shape, your weight, or your food intake, you can address different types of distortions that are about that, like denial. It's just a muffin, or it's a carrot muffin, it's still a 400-calorie muffin. Or I'm discouraged, I have no point to continue, it's just too much weight to lose. Set incremental goals for yourself instead of large, discouraging type goals. Justification. Well, I deserve a treat. Everybody else is eating it. Notice when you have types of thoughts like that recur. Once in a while, it's not the end of the world, but if it's a pattern, and then you're reinforcing that pattern. Need to please. Well, I can't not have birthday cake. It's my cousin's birthday. Well, you can not have it. People do all the time. what would be an alternative for you, whether it's a smaller piece or whether not at all and having another a fruit as a replacement. And perfectionism. Well, I'm not eating perfectly right now, so I might as well not try until next week when I'll start eating perfectly. So we also want to help with long-term choices like chocolate cake. Well, it may make you happy for a few minutes, but what we know is that the flavor pleasure that you get from a reinforcing food is actually only in the first few bites. And so it might make you temporarily happy, but these repeated exceptions end up adding up. And find things that are more long-term that actually make you more pleased with yourself, more content, and involve a longer-term planning. Sleep, huge factor for managing thoughts, emotions, and weight. So when it comes to lack of sleep, it increases our impulsivity. When it comes to the hormones associated with sleep deprivation, well, there are increased hunger hormones like ghrelin and decreased levels of leptin, which are involved in fullness or satiation. So learning also is very important when it comes to shape and weight and balancing nutrition. The more we know. So there's evidence that education about nutrition can prevent obesity and reduce the risks. Teaching how to modify your lifestyle and gain more control and self-control with eating has a major role in reducing weight. Using Canada's food guide as an example, like 50% of your food should be vegetables, consulting a nutritionist, consulting a dietitian, or some kind of coach, and having the simple equation of calories in, calories out be your guide. I know how much I'm burning, I know how much I'm taking in. Tricks and shortcuts don't work. A lot of things, a lot of fad diets promote ways to trick your brain, your body, your eating habits, and they ultimately are not helpful in the long term. What we need to know is the math. Things like 1 pound of fat equals 3,500 calories. In 1 week, consuming 500 calories or less per day can help you reduce the amount of fat that you're keeping on you. Or if you spend 500 calories more, you go for a run, you know exercises you can do that promote the burning of 500 more calories. We do know that there are hormone issues, gland issues that are not 100% in out for everybody, but overall knowing what your metabolism is like and responding to it accordingly. A healthy weight is calculated typically in terms of body mass index, which is a BMI of 25 or less. And just to be cautious that it's 19 to 25, under 19, and then we're looking at concerns about underweight. Learning about healthy eating in terms of calories, portion sizes, and nutrition. Treating them like a budget. Each day I have, let's say, 1,800 calories to spend on food. How am I going to portion that out? Can I make sure that a good 900 calories of that is going to be in fruits and veggies? Can I let the rest of it be whole grains and low-fat proteins? Can I make lists of foods that are less calorie dense that I could easily substitute when I have a craving for something that's high calorie density? Having a calorie counter can help if there's no issues with preoccupation. If you're not overly preoccupied with calorie counting, then you can look for a phone app, get yourself a book to track your intake, see what you can spend your calories on, and just like you would do with a financial budget, prepare and plan for that. Also an exercise counter, whether it's a watch or something that you can use that counts how much calories you're actually spending to be more accurate. And finally, watch out for the types of foods that are higher calorie density. Pound for pound, fat has more calories in it than carbohydrates and proteins. So 1 gram of protein, 1 gram of carbohydrates equals 4 calories. 1 gram of alcohol equals 7 calories, and 1 gram of fat equals 9 calories. And basically, metabolizing fat to fat, it just stays there. Whereas if you eat complex carbohydrates, your body actually has to work to burn those. What we've seen also in studies is that rats with unlimited fat diet have more likely become obese, but with unlimited carb diets, they don't tend to. And there are similar results with people who don't naturally eat less just because it's fatty. If you eat whatever amount, if it's fat, you've just ingested more calories. So there are people who say, well, you'll eat less if you eat fat because you'll feel fuller. It isn't necessarily true. The other pieces are when it comes to deprivation, don't deprive. Delay, cravings, they're like feelings of panic, like you feel this urge, like you have to do it. Well, the less you give in, the less frequently they arise. They can be squelched by things like urge management, or they can be replaced with healthier responses rather than giving into those urges. So you have a craving, well, you can tell yourself, I'll give into it later. You consider a walk to the grocery store later if the craving is still there. Or, and again, we're differentiating cravings from hunger. If you have hunger, then you want to be able to set yourself up to eat appropriately. But if you have a craving, you can see, is something less calorie dense going to be able to replace this? Can I have a small square of dark chocolate instead of a whole candy bar? Can I retrain my palate with whole foods that are more sustainable instead of having calorie dense foods available to me as my only option? Can I keep temptation away? Stimulus control strategies. What does that mean? It means you don't keep foods around if you eat too much of them. If you know these are triggers for you, if you know that if you have a bag of chips, that bag of chips is going to be gone, try not to buy that. If possible, cook only what's necessary or prepare only what's necessary. If you have a frozen pizza, cut the portion you're going to eat, put that in to cook instead of the whole pizza where you'll be tempted to eat the whole thing. Grocery shopping from a list, grocery shopping after eating. Know when you're tempted, know how to balance your temptation. Keep high calorie density or less healthy foods in opaque containers so you're not tempted, so you don't see them too often. And drink alcohol in moderation. First of all, being that it's empty calories, but also that it lowers your resolve, so you're more likely to eat excessively when you are consuming alcohol. Liquids and fiber are something that we also would promote in terms of fiber. It's essential in terms of our intestinal health, and it also keeps us fuller longer. So whole grain foods such as bread, pastas, and cereals instead of foods that remove the whole grain. Fruit, especially dried, has a lot of fiber, but be cautious. They can be a lot more calories than we realize. We're more likely to eat a lot of dried grapes or something in terms of raisins than we already eat whole grapes with the water content. But know that it's available to you for fiber. Nuts and seeds also higher in fat, but consider those as ways to get your fiber. Water, it's essential in so many ways. It can help you feel full by taking up space in your stomach. So find ways to get what's recommended, 6 to 8 cups of water a day. It's calorie free and it also promotes healthy digestion. Know that there are studies where people who have soup before a meal, so there's more water content, end up eating fewer calories in total. And sometimes you actually may think you're hungry when you're in fact thirsty. Water and fiber work together to eliminate that waste. And so when you look at not just calories in, you're also looking at voiding in order to balance your feelings of fullness and feeling. It also has promoted mental health when you're able to eliminate waste. Eating mindfully, eating in the present moment, eating while noticing what you're eating while paying attention to the sensations and experiences of eating. So getting hungry, not starving, by planning meals, planning them at expected times. Practice regular eating, noting that we talked about eating every 2 to 3 hours is helpful. Try portions of 150 calories or less, depending on what your food intake needs are for the day. 3 meals a day of approximately 500 calories or less. This is approximately a 2,000 calorie a day estimation, but if it's less that you need, recognize what you need and budget accordingly. Know that breakfast is important. There's a lot of studies that show people who eat breakfast tend to have a healthier weight, and that keeping healthy snacks at the office is also very important. Even if you're working from home, having things set up so you don't find yourself running to the kitchen all the time or a vending machine or ordering in. Having vegetable juice, baby carrots, whole grain crackers, and peanut butter, and keeping healthy snacks with you if you have to be out and about. Be a gourmet, enjoy your food. Eating mindfully is not eating restrictively, it's actually eating with enjoyment, going for quality over quantity, maybe using smaller plates or utensils, taking a healthy portion and eating it slowly. Notice what it feels like to eat slowly, mindfully, between bites, putting down your fork, thinking, communicating with people while you're eating. Drinking water to clean your palate, and truly mindfully focusing on your senses. Taste each flavor. Feel each texture. Look at the look of the food on the plate. Practicing active living is just a rule in general for good, healthy body mind. Making exercise structured, fun, and sustainable. What did you like when you were a kid? Team sports. Did you like swimming? Maybe it's not available to you right now. Did you like dancing? Are there ways you can do that now, even when you're not able to do it due to the current pandemic? What gets you to move? Do you respond to obligation? Like if you pay for a class, will you be more likely to do it? If you have a buddy, will you more likely go for your run or your walk? External pressure can be useful. Don't judge it. Allow it to be possible. Structure and plan. Use the SMART goals we talked about. Adapt activity to your healthy lifestyle. If you have to take public transportation or even drive your car, can you park farther away from where you're going to encourage more walking? Can you take stairs more often if you have to take an elevator? Can you include aerobic exercise? There's cost benefit to different types. Walking will have less impact on your joints, so it will be helpful in that way. Running maybe has more impact in terms of weight loss quickly, but again, depends on your metabolism, but it will, deal with decreased susceptibility to bone loss or osteoporosis. However, it can have an impact on your joints. There's benefits to anything that you choose, knowing that the balance of muscle and cardio is a very helpful thing, and you can consult a professional if you want some specific guidelines on that. Create body positivity. When it comes to what we tell ourselves and what we feed ourselves mentally, it really makes a difference to what we are choosing to feed ourselves in terms of nutrition. Appreciate all that your body can do. Be willing to keep a list of things that you like about yourself instead of always focusing on what you don't like about yourself. Remind yourself that true beauty is not simply skin deep. Can you look at yourself as a whole person? Can you surround yourself with positive people who reinforce that positivity? Can you get this mirror effect of when people are supportive of each other? Shut down the voices in your head that tell you your body is not right, or there's some kind of judgment, or you're bad or wrong for the shape or look of your body. Wear clothes that are comfortable and make you feel good about your body. And become a critical viewer of social media and media messages. All of these images, all of these things that we're feeding our mind are affecting how we're treating our body. Do something nice for yourself. Show yourself kindness. Treat your emotions and your thoughts and yourself kindly with compassion. And use the time and energy that you might have spent preoccupied with this perfect body to do something to help yourself as well as help others. I thank you very much for your time today. I look forward to answering questions, and I welcome you to take these tips and this feedback and go forward with a healthy mind and healthy body. Thank you.